As we age, small daily habits can have a powerful impact on metabolic health. One of the most overlooked is how we drink water. Proper hydration is not just about quenching thirst, it plays a vital role in how the body manages blood sugar and protects against diabetes. Hydration supports healthy blood sugar regulation by influencing how efficiently the body manages glucose, insulin, and cellular energy. Water is involved in nearly every metabolic process, and even mild dehydration can disrupt the delicate balance required to keep blood sugar within a healthy range. For seniors, this relationship becomes even more important, as age-related changes in metabolism, kidney function, and thirst perception increase vulnerability to blood sugar fluctuations. When the body is properly hydrated, blood volume remains stable, and glucose is more evenly distributed throughout the bloodstream. Adequate water intake prevents blood from becoming overly concentrated, which can otherwise lead to higher measured blood sugar levels. In dehydrated states, the same amount of glucose circulates in a smaller volume of fluid, increasing its concentration and placing additional stress on insulin signaling pathways. Over time, this can worsen insulin resistance and make blood sugar more difficult to control. Hydration also supports insulin sensitivity at the cellular level. Water helps transport glucose from the bloodstream into cells, where it can be used for energy. When cells are well hydrated, insulin receptors function more efficiently, allowing glucose to enter cells more smoothly. Dehydration, on the other hand, can impair this process, causing glucose to remain in the bloodstream for longer periods and contributing to elevated blood sugar levels. The kidneys play a critical role in blood sugar regulation, and their function depends heavily on hydration. Kidneys filter excess glucose from the blood and excrete it through urine when levels rise. Adequate water intake supports this filtration process, helping the body remove excess glucose and maintain balance. In dehydrated conditions, kidney efficiency declines, reducing glucose clearance and increasing the burden on insulin regulation. Hormonal balance is another area influenced by hydration. Dehydration triggers the release of stress hormones such as cortisol and vasopressin, which can raise blood sugar by signaling the liver to release stored glucose. Consistent water intake helps keep these stress responses in check, reducing unnecessary glucose release and stabilizing blood sugar throughout the day. For seniors, maintaining hydration requires intentional habits, as thirst signals often weaken with age. Drinking small amounts of water regularly, rather than waiting for thirst, supports steady glucose regulation. Choosing water instead of sugary or sweetened beverages further protects blood sugar levels. By prioritizing hydration, seniors create a metabolic environment that supports insulin function, reduces blood sugar fluctuations, and promotes long-term glucose balance. Timing of water intake matters for glucose control because the body's ability to manage blood sugar changes throughout the day in response to meals, hormones, activity, and hydration status. Drinking water strategically can support insulin function, reduce glucose spikes, and improve overall metabolic efficiency, especially in seniors who are more sensitive to fluctuations in blood sugar levels. Starting the day with water is particularly important. During sleep, the body loses fluids through breathing and perspiration, leading to mild dehydration by morning. This dehydration can concentrate blood glucose and increase insulin resistance upon waking. Drinking water shortly after getting up helps rehydrate cells, dilute circulating glucose, and support insulin sensitivity before the first meal of the day. This simple habit sets a healthier metabolic tone and may reduce morning blood sugar elevations. Water intake before meals also plays a meaningful role in glucose regulation. Drinking water 15 to 30 minutes before eating supports digestion and slows gastric emptying slightly, which can help moderate post-meal blood sugar spikes. Proper hydration allows digestive enzymes and insulin signaling to function more efficiently, helping the body process carbohydrates in a more controlled manner. For seniors, this practice can be especially beneficial in preventing sharp rises in blood glucose after meals. Drinking water during meals should be done mindfully. Small sips support swallowing and digestion, but excessive fluid intake during meals may dilute stomach acids and impair digestion for some individuals. Balanced hydration throughout the day ensures that the body does not rely solely on mealtime drinking, maintaining steady blood volume and glucose regulation. Water intake between meals is equally important. Regular hydration helps prevent dehydration-related glucose concentration and supports stable insulin signaling. This approach is more effective than drinking large amounts infrequently. which can stress the kidneys and lead to rapid fluid loss without sustained metabolic benefit. Evening hydration also requires attention. Drinking water earlier in the evening supports overnight metabolic stability, while excessive intake just before bedtime may disrupt sleep. Quality sleep is closely linked to blood sugar control, as poor sleep increases insulin resistance and stress hormone release. By aligning water intake with the body's natural metabolic rhythms, morning rehydration, pre-meal support, steady intake between meals, and balanced evening hydration, seniors can use timing as a simple yet powerful tool to support glucose control, reduce blood sugar variability, and protect long-term metabolic health. Dehydration increases insulin resistance by disrupting the body's ability to regulate glucose efficiently at both the cellular and hormonal levels. Insulin resistance occurs when cells become less responsive to insulin's signal to absorb glucose from the bloodstream, leading to higher blood sugar levels. Even mild chronic dehydration can quietly contribute to this process, especially in seniors whose metabolic systems are already more vulnerable to imbalance. When the body lacks sufficient water, blood volume decreases and becomes more concentrated. This concentration raises blood glucose levels, making it harder for insulin to move glucose into cells. In response, the pancreas must produce more insulin to achieve the same effect, placing added strain on insulin-producing cells and accelerating insulin resistance over time. Dehydration also affects the function of insulin receptors on the surface of cells. Water is essential for maintaining the structural integrity of cell membranes and supporting efficient cellular signaling. When cells are dehydrated, insulin receptors may not function optimally, reducing their sensitivity to insulin and impairing glucose uptake. This leaves more glucose circulating in the bloodstream, reinforcing insulin resistance. Hormonal changes triggered by dehydration further worsen the problem. When the body senses low fluid levels, it releases stress hormones such as cortisol and vasopressin. Cortisol signals the liver to release stored glucose into the bloodstream, raising blood sugar levels. Vasopressin, while helping the body conserve water, is also associated with increased glucose production. These hormonal responses are helpful in short-term survival, but harmful when dehydration is frequent or ongoing. Kidney function is another critical factor. Healthy kidneys help regulate blood sugar by filtering excess glucose from the blood and excreting it through urine. Dehydration reduces kidney filtration efficiency, limiting this protective mechanism. As a result, excess glucose remains in circulation, increasing the demand for insulin and contributing to insulin resistance. In seniors, reduced thirst perception makes dehydration more likely, even when water needs remain high. Medications such as diuretics can further increase fluid loss, compounding the risk. Without consistent hydration, insulin resistance can gradually worsen without obvious symptoms until blood sugar levels become persistently elevated. Maintaining regular water intake supports blood volume, improves insulin receptor function, stabilizes stress hormones, and enhances kidney glucose clearance. Small, frequent sips throughout the day are often more effective than large, infrequent intake. By preventing dehydration, seniors can reduce a hidden driver of insulin resistance and support healthier blood sugar control over time. Water supports kidney function and glucose balance by enabling the kidneys to efficiently filter blood, regulate fluid levels, and remove excess glucose from circulation. The kidneys play a central role in maintaining metabolic stability, and their ability to perform these tasks depends heavily on adequate hydration. For seniors, supporting kidney health through proper water intake is especially important, as kidney efficiency naturally declines with age. Each day, the kidneys filter large volumes of blood, removing waste products, excess electrolytes, and surplus glucose. When blood sugar levels rise, the kidneys act as a secondary safeguard by filtering out glucose and excreting it in urine. This process helps prevent excessive glucose buildup in the bloodstream. Adequate water intake ensures that this filtration system operates smoothly, allowing glucose to be cleared without placing unnecessary strain on kidney tissues. Dehydration reduces blood flow to the kidneys, limiting their filtering capacity. When fluid levels are low, the kidneys conserve water by producing more concentrated urine. In this state, their ability to remove excess glucose is diminished, allowing glucose levels to remain elevated in the blood. This increases the workload on insulin and contributes to poor glucose control over time. Water also supports electrolyte balance, which is essential for proper kidney and metabolic function. Electrolytes such as sodium and potassium influence insulin signaling and glucose transport into cells. Adequate hydration helps maintain these electrolyte levels within a healthy range, supporting efficient glucose uptake and reducing metabolic stress. Another important role of water is its influence on blood pressure. Dehydration can lead to reduced blood volume and increased blood pressure fluctuations, which impair kidney function and worsen glucose regulation. Stable hydration supports consistent blood flow to the kidneys, enhancing their ability to regulate both blood pressure and blood sugar. In seniors, hydration is often compromised by a reduced sense of thirst, medications, or fear of frequent urination. Despite these challenges, regular water intake is essential for preserving kidney function and metabolic balance. Drinking small amounts consistently throughout the day is more effective than consuming large volumes infrequently. By supporting kidney filtration, electrolyte balance, and blood flow, water plays a vital role in maintaining glucose balance. Prioritizing hydration helps reduce the burden on insulin, supports healthy blood sugar levels, and protects kidney health, making it a simple yet powerful tool for long-term metabolic well-being. Simple hydration habits can reduce diabetes risk by supporting the body's natural ability to regulate blood sugar, improve insulin sensitivity, and maintain metabolic balance. Water is often overlooked as a preventive tool, yet consistent hydration influences multiple systems involved in glucose control. For seniors, adopting small, practical hydration habits can make a meaningful difference in lowering the risk of developing type 2 diabetes. One of the most effective habits is drinking water regularly throughout the day rather than waiting for thirst. As people age, the sensation of thirst becomes less reliable, increasing the risk of chronic mild dehydration. This dehydration can concentrate blood glucose and increase insulin resistance. By sipping water at regular intervals, seniors help maintain stable blood volume and support efficient glucose distribution, reducing unnecessary strain on insulin pathways. Starting the day with water is another simple but powerful practice. Overnight fluid loss leads to mild dehydration in the morning, which can elevate fasting blood sugar levels. Drinking water shortly after waking helps rehydrate cells, dilute circulating glucose, and prepare the body for better insulin responsiveness during breakfast and throughout the day. Choosing water over sugary or artificially sweetened beverages is equally important. Sugary drinks cause rapid spikes in blood glucose, while artificial sweeteners may disrupt insulin signaling and appetite regulation in some individuals. Replacing these beverages with water reduces excess glucose intake and supports steadier blood sugar levels. Adding natural flavor, such as lemon or cucumber, can make water more enjoyable without affecting glucose control. Drinking water before meals can also help moderate blood sugar responses. Hydration supports digestion and may slow the absorption of carbohydrates, leading to more gradual rises in blood glucose after eating. This habit is especially helpful for seniors managing prediabetes or insulin resistance. Even small lifestyle adjustments, such as keeping a water bottle nearby or pairing water intake with daily routines, can reinforce consistency. Adequate hydration also supports kidney function, helping the body eliminate excess glucose and reduce metabolic stress. Over time, these simple hydration habits create an internal environment that supports insulin sensitivity, stabilizes blood sugar, and reduces diabetes risk. By making water a regular and intentional part of daily life, seniors can take a proactive, accessible step toward protecting long-term metabolic health and overall well-being. In summary, the way seniors drink water plays a far more important role in blood sugar control than most people realize. Proper hydration supports insulin sensitivity, prevents blood glucose from becoming overly concentrated, and allows the kidneys to efficiently remove excess sugar from the bloodstream. Timing water intake, avoiding dehydration, and choosing water over sugary beverages all work together to create a healthier metabolic environment. Small, consistent hydration habits can reduce unnecessary stress on insulin pathways, stabilize blood sugar levels throughout the day, and lower the long-term risk of developing type 2 diabetes. By making mindful water intake a daily priority, seniors can take a simple, natural, and empowering step toward protecting their blood sugar, preserving metabolic health, and supporting overall vitality as they age.